The first moments after arriving in the hospital after a stroke are completely chaotic and hectic and incredibly frightening, I'd imagine. The focus for the team of clinicians looking after a person who's just come into the hospital with a suspected stroke is to really identify how severe is the stroke, how big and how bad is the stroke, and what area of brain is affected. And really to try and identify what's the likelihood of things getting any worse than they currently are. The very next priority is a scan of the brain to try and help us to look at the stroke if we can. And after that, the very next priority often is admission to a stroke unit and care by stroke specialist clinicians. There might be some other advanced brain imaging that might be done, so that often means an injection of contrast dye into the vein so that the blood vessels can be seen and have a more detailed look at the blood flow to the brain. Looking at the blood vessels in the neck, so to see if there's a blockage there that might have been contributed to the cause of stroke, and that would help to know what's the best treatment in the long term to prevent another stroke. Some other tests that are often done are sort of more detailed examination of the heart with an ultrasound. Certainly blood tests. Blood tests are taken very early on and in follow-up. Things like cholesterol levels and glucose, sugar level in the blood. For most people, they're the most important tests that need to be done in the initial stages while somebody's in hospital having had a stroke.
It's a crisis event, and so it often comes out of the blue. Most people are not expecting that they're going to be in hospital, that day or a few days with a stroke. And so people will have different understandings about their stroke and how it might affect them, different levels of experience. So it's really our physiotherapist's role in those early days to help explain what we do and our role and what's normal to expect in those early days after a stroke.
It certainly changed my life, and it was very worrying the first few days because we weren't really sure, if she was going to have another stroke or what the end result was really going to be. It was a sort of an unusual situation to be in where it felt totally out of control. And tried to inform myself as much as I could and pass on as much as I could to Joy as well. And
the best knowledge was that there's a 96% chance of no second stroke. And once we found that, we knew we had something to work on.
My specialist tended to talk to my wife in front of me, and she would explain things to my wife. I was getting quite hurt about that because I wanted to know what was going on. Later on, I understood that I didn't understand what was going on. I wouldn't have remembered what he was saying. And it was important for my wife to know, but I know he came one day when my wife wasn't actually at the hospital and said to me, I'll ring your wife and explain everything to her. And I felt quite hurt by that, but she was able to remember, whereas I wouldn't have.
So, it was an interesting night for everybody around me, really. I'm glad I was me and not them, because in many ways I was blissfully unaware. I was cold and my hair was annoying me. When they give you thrombolysis treatment, it can cause a bleed in your brain, so a second stroke but from a different cause. And so for a period of hours they have a nurse sitting there staring at the screens that are monitoring all of your vital signs. There's direct observation.
They weren't sure what had happened, but even by the time I got there, which probably was 2 hours later, he was slurring his words quite badly even then. And whilst he knew me, he didn't really know what had happened to him. That evening, things got worse. Pressure was building in his head. He'd had a hemorrhagic stroke in the cerebellum, and they operated that night. A big hole in his forehead to relieve the pressure. We went in the next morning and he was in intensive care, on life support for 5 days.
They basically had the neurologist, the cardiologist, and they diagnosed within 3 days why I had a stroke. And it was probably a relief to know that it was a hole in my heart. It wasn't cholesterol, blood pressure, or anything major. The treatment started at about day 3 to get me out of bed. Started looking at optimistic, outcomes, and the doctor said, the potential for full recovery is possible in you. So it was a really positive, period in those first few weeks to have the encouragement of the doctors and the staff. They basically saw that I was motivated, but also believed that I could recover.
It started straight away. Basically, as soon as I came out of my coma, I was back into OT, physio, speech pathology, the whole kit and caboodle. It was, just relearning everything again. Once I came out of the coma and once, I actually started getting it together, it sort of just, snowball effect, just progressed.
In Singapore, the hospital was fantastic, but when he was ready to go to rehab, their rehab is hopeless. It was a long way out of town, and I went out to see it because he could have stayed in Singapore, and they had like an 8-bed ward, and I said, well, how many physio sessions will he get a day? Because I knew that OT and physio is absolutely critical, and the earlier the better, and the more the better, and they said, I'd have one session each day, and I said, what's he do the rest of the day? He'd just be lying in the bed. And we had good insurance because we were expats there. I said, okay, we'll pay for more. And they said, we just don't have any more. So then we said, we've got to come home. So then the saga to get him home began.
It took me a few days for the reality of the situation to sink in. I woke up and saw I was in a hospital, and my brother had flown back from Scotland, and people were crying. It was all a bit emotional. But, I just sort of heard what had happened and heard what I need to do to recover, and thought, oh, it's disappointing, but I didn't get sort of depressed and down about it. I just thought, well, I'm down here. If I want to get back up to here, then I've got this amount of work to do. So didn't worry about life prospects or any of that. Just thought, right, well, today I've got to do my leg exercises, tomorrow's eye exercises, the day after it's occupational therapy. So yeah, just got on with it.